be looking at what contact tracing looks like in the new world order.
I want to emphasize that now is not the time to be traveling, period. Internationally or domestically, it's just not a good time to be traveling.
You guys look what's going on in Australia right now. You know, they're enforcing, after a year and a half, they're still enforcing lockdowns by the military. And that's not a free country. It's not a free country at all. In fact, I mean, I wonder why we would still, have the same diplomatic relations when they're doing that. I mean, is Australia freer than China, communist China right now? I don't know. The fact that that's even a question tells you something has gone dramatically off the rails.
We know what works. What works is to stay home. And there's no mystery about this.
You're starting to see that the daily increases are not in that steep incline. They're starting to be able to possibly flatten out.
Which makes internet-connected thermometers shows the nation's fever hot zones. Fevers are a key symptom of COVID-19. The New York area and Florida are bright red. But look at this map showing fever trends over the last 7 days. The deep blue areas are seeing the biggest decrease in fever rates.
In Contra Costa County, where there are now mobile COVID strike teams.
As they're taking the vaccine to the people who need it the most.
One of the strike teams arrived at the Hacienda Senior Living Complex in Martinez this morning. As they set up in the community room, the residents came down from their apartments. And that's about as far as many of them can travel.
364, 33 confirmed cases since the start of this pandemic. Excuse me, please.
If the unvaccinated get vaccinated, they will protect themselves and other unvaccinated people around them. If they do not, states with low vaccination rates may see those rates go up, may see this progress reversed. Ultimately, those who are not vaccinated will end up paying the price.
I think it's a big mistake. Look, I hope everybody's realized by now, these masks make a difference. And the last thing we need is the Neanderthal thinking that in the meantime, everything's fine, take off your mask, forget it.
I still have not yet received a phone call or an apology from the president for his mischaracterization of my actions. All the liberals and all the media in the state of Texas issued the same declaration. Some people said that I had issued a death warrant. And here's the difference. The people on the Democrat side, they want to push narratives, whereas what I was looking at was both math and science.
For example, at this vaccination site here in Raleigh today, they've only had 5 people come by for vaccinations. The governor told me he's been talking with both Democrats and Republicans about trying a lottery in North Carolina. The federal government recently gave states the clear go-ahead to use federal money for a lottery. They saw the success Ohio had recently, and officials at the White House called it a good idea. This week, the state gave away its first $1 million prize. And after announcing the lottery, the Associated Press reported the vaccination rate there jumped by 1/3, but the pace of vaccinations is still not as high as it was earlier this year.
Whatever works, whatever gets people vaccinated, we want to try.
Now, the Democrats' vaccine mandate power trip has now made it, of course, to our southern border, but not for the untold millions of migrants illegally entering the country, as I just said. Instead, the Biden administration is now poised to punish Customs and Border Patrol agents.
Whistleblower told us that the Border Patrol was given official notice that if Border Patrol agents don't get the vaccine by November of this year, so 6 weeks from now, if they don't get the vaccine, they're going to be fired. So meanwhile, today we had a briefing from Secretary Mayorkas, and we asked him about what's happening with this flood of migrants coming across the border, our southern border. And he said, relative to the vaccine, he said, we asked them if they want it. It's their choice. So think about that. The people who have been busting their tails, enforcing our law, doing their job on the border, they're going to get fired if they don't take the vaccine. Meanwhile, for people who break the law and come in here, no big deal. Your choice. It's up to you. People who just a year ago, like doctors and nurses and police officers, were heroes. Now they're saying you're going to lose your job if you don't take a vaccine. The same vaccine, by the way, that Kamala Harris said she wouldn't take a year ago. This is ridiculous, and the American people know it's ridiculous.
We have nursing shortages. Police officers being fired. They're bringing in foreign workers to take the jobs of Americans who don't get the vaccine.
We are confronted with a population of people that, as a general matter, have a rate of illness of approximately 20%.
This is your option. You can get vaccinated or you can file for an exemption. If you do that and choose not to get vaccinated, then you have to get tested twice a week. Why are you against that?
Well, because the policy for, first of all, is schizophrenic. The teachers have a different policy. The teachers are literally, you're vaccinated or you get tested. You don't have to report your vaccine status. We have a mandate to report our vaccine status by midnight tonight.
She said no one's going to be sent home immediately. It's going to take a few days for them to figure out who is and is not complying. She says, but if you don't agree to take the vaccine or get tested twice a week, quote, we will move forward and put people on a no-pay status. How will your officers pay their bills?
Well, I guess we're going to see how that works out, because we had a meeting the other night and our lodge had never been more filled with members. They are literally engaged in this fight going forward. They were willing to go into a no-pay status at midnight tonight and get sent home if that's what was going to happen, and get locked out by the city. I don't know that that's going to change very much if now they're threatening suspension or even termination. You know, the reality is we have a profession nobody else wants to do right now. They cannot get anybody to go into this police academy. But yet here she is vilifying the police yet again in a city that has over 185 expressway shootings this year alone. Over 280 kids shot this year alone, and she acts like there's nothing else going on but this COVID.
To get into a New York City restaurant today, you're supposed to show your vaccine card when you walk in the door. Show us your card.
Well, there's a lot of pushback. It's worse than that, Stuart. You not only ask for the vaccine card, you must ask for ID to prove it's your vaccine card. It's not just a card. You have to show me your driver's license, passport, or whatever else to demonstrate that that's your card. It's almost a subtle dismantling of an industry. We're stressed already for staff, for servers, for cooks, as you well know, Stuart. And now we have to hire somebody at the front door to check the vaccine card, maybe two people if you're really busy, because somebody else checking the ID against the vaccine card.
Out of all the COVID variants emerging all the time and floating around among us, one of them, called R1, got into a nursing home in eastern Kentucky this past March, where almost everyone was vaccinated. And that R1 COVID variant was able to infect 1/4 of the vaccinated residents. Has his eye on R1. In that Kentucky nursing home, one of the vaccinated patients died. 2 of the unvaccinated patients died. R1 has since spread to all but 3 states. More than 2,200 cases nationwide. And R1 is in Georgia. Fewer than 100 cases here so far. In all, more than 10,000 R1 cases worldwide.
This virus, this particular strain, has a potential to get around. It is doing it differently from many of the other viruses.
Dr. Hazeltine says R1 can simply overpower vaccine antibodies.
It's doing it mostly by making more of itself once it gets into the body, not only by evading what happens on the way in.
And the CDC says that in that Kentucky nursing home, because 1/4 of the vaccinated residents were infected, there is concern about potential reduced protective immunity to R1.
The Delta variant is the dominant strain of the COVID-19 virus spreading across the country right now, but scientists are keeping an eye on another variant known as Mu.
With reaction to news, this new strain could be vaccine resistant.
Carolyn, local health experts say it is still too early to know for sure if that variant is resistant to vaccines, which is why
over the course of the pandemic, the COVID-19 virus has transformed again and again. And now there is a new mutation called the Mu variant that the World Health Organization is keeping an eye on.
Currently, it's listed as what we call a variant of interest.
Health officials believe the Mu variant is highly contagious and could possibly be resistant to COVID-19 vaccines. LA County's health department reports at least 167 cases of the Mu variant between June and August, most of them discovered in July. But according to the Hospital Association of Southern California, the current surge in cases is driven primarily by the highly transmissible Delta variant, which remains the most concerning strain. The Mu variant was first found in Colombia back in January and detected in 39 countries since.
Variant was discovered in a Stanford lab last week, but they did not say where in the Bay Area that strain was found.
The variant, dubbed a double mutant by the Indian media, was discovered, as Andre mentioned, by the Stanford's clinical virology lab. And they're not mentioning where they found that at, but they're saying this highly transmissible variant is something to be concerned. Bay Area health experts warn you to stay cautious. The double mutant is the latest in a growing and diverse field of viral variants, but it has 2 mutations that make it easier to catch.
If you are in an elevator with someone who is infected with the variant, you are more likely to transmit. You are more likely to be infected by that variant.
Says he's concerned about its presence in the Bay Area, but says the UK variant B117 is more transmissible. The more the virus replicates, the more chance the virus has to mutate into something more concerning.
The Delta variant is carving a deadly path through Southeast Asia, with cases hitting new highs across the region. Genomics experts in the United Kingdom say that the strain is the biggest risk to the world. They're warning that those most at risk are still the unvaccinated.
Clearly, this Delta variant is much more transmissible than the Alpha, which most of it's replacing. It's something like 60% more transmissible, and now looking at an R0, an average infection rate of perhaps as high as 6 for each person who's infected with Delta. So
for every person who gets sick, how many other people are they likely to infect? So for seasonal flu, that's usually about 1. Smallpox, on the other hand, it's over 3. Now, before we had a vaccine, polio spread at a rate between 4 and 6. Now, we call that number the R0. R stands for the reproductive rate of the virus.
Any ideas what that might be for this?
How fast it multiplies depends on a variety of factors.
It's something like 60% more transmissible, and now looking at an R0, an average infection rate of perhaps as high as 6 for each person who's infected with Delta. That's already tricky. This variant is transmitting more by aerosol than the Alpha variant. So some of those containment measures that we've been looking at, such as hand washing, are less effective against this Delta variant. So it is a worse one. And this Delta variant is also a bit more resistant to the vaccine.
The CDC now says that Delta variant is more contagious than the common cold, than chickenpox, even Ebola. And new data shows that the viral load is the same in infected, vaccinated people as people who have not gotten their shots, meaning vaccinated people are still contagious. And the New England Journal of Medicine found that breakthrough cases are mild, but those symptoms can linger beyond 6 weeks.
We are going to be in COVID world for the foreseeable future. It's actually not clear what the end game will be. And the end game may be worse than where we are now, because there's no guarantee that Delta is the worst variant we could possibly see.
The original Wuhan, China strain of the virus mutated. Many are calling it the European strain of the virus. Scientists have determined that the COVID virus developed new spikes on its exterior, making it better able to cling on to cells and spread. But the D614G mutation, as it's called, doesn't appear to be as deadly, and that may help explain why the number of cases is exploding worldwide. It's normal and expected for a virus to mutate.
But the concern always with a virus that it mutates so quickly that what measures you have put in place, whether a vaccine or a drug, will not be effective anymore.
Points out that the flu virus mutates like this every year, but because the flu is more known than COVID-19, we're able to adapt a vaccine more quickly.
That alarming new report from the CDC. The number of COVID-19 infections in the first months of the pandemic estimated to be likely 10 times higher than previously thought. The study looking at antibody tests in 10 cities and states from March to May, finding depending on the location, the case rate could be 6 to 24 times more than initially reported. They were asked if they would send their kids back to school without one.
I honestly don't know the answer yet, even for my 3 children. We're wrestling with the same challenges parents across the country are trying to figure out the right thing to do.
But several states are still seeing the virus spread at alarming rates. And as we fight to contain the virus, it continues to mutate and spread. The UK variant of COVID-19 now detected in at least 23 states.
It just seems to be dragging on. It has a lot to do with this Delta variant. It's taking hold of unvaccinated America. There's growing concern from top health officials and doctors over the prolonging of the coronavirus pandemic now. According to the CDC, new cases have been rising for a month. So far, 69% of adults in the country have received at least 1 dose of a COVID vaccine, and 49% of the population is fully immunized.
According to that latest model, over the next 3 weeks, there could be anywhere between 90,000 and 800,000 new cases. And some experts say that wide range indicates the CDC doesn't really know where the outbreak is headed.
163 million people in the U.S. are now fully vaccinated against COVID-19. While that's nearly half the population, experts say it isn't enough.
We're going in the wrong direction.
Nationwide, the number of new cases has risen nearly 50% in the past week, with all 50 states reporting increased infection totals. The renewed spread has been attributed to the virus's more contagious Delta variant. Florida now accounts for 1 out of every 5 U.S. cases. Some doctors there say all their recent COVID patients are unvaccinated.
Several patients here in this unit are already asking, can you give me the vaccine now? It's kind of too late.
In Los Angeles County and elsewhere, indoor mask mandates have returned, even for those who've gotten their shots.
The quality of the mask does matter, so if you can get your hands on a KN95 mask or an N95 mask, that's going to afford you a lot more protection.
Many school districts say masks must be worn once classes start in a few weeks. A number of schools and colleges are also requiring vaccines for everyone who's eligible.
COVID-19 is now blamed for 4.1 million deaths around the world, including more than 610,000 here in the U.S. and Florida, Texas, and Missouri had the most cases last week. According to Johns Hopkins, Texas and Missouri fall below the U.S. average when it comes to the percentage of their populations fully vaccinated. Florida is right around the U.S. average of 50% vaccinated.
Scientists in Ohio say a U.S. variant has been circulating since May. And researchers in California say a newly identified strain has been found in more than 1/3 of the cases in Los Angeles.
We need to vaccinate enough people to reach herd immunity before the viral variants mutate and are able to evade vaccine-induced immunity.
Many areas still fighting through a stunted vaccine rollout. Some sites seeing hours-long wait times, others failing to use up all their doses. Berta and Mike Powers have struggled to even get an appointment, only to see that appointment canceled.
The fact of the matter is, what good is a vaccine if it doesn't get into people's arms?
Multiple states now say they're churning through their available doses, and several governors are now urging the federal government to step up distribution.
This shouldn't be the Hunger Games like it was with PPE, right? That was ridiculous, and we all had to play that game.
And now local news outlets are reporting wealthier zip codes, like some in Miami-Dade or Dallas counties, are also some of the most vaccinated, with higher income areas receiving a disproportionately large amount of the vaccine. Many of the people lucky enough to get the shot are trying to urge others to follow their lead. 70-year-old Shirley Kemp received her first dose this week in Florida, and she hopes to inspire other seniors to sign up too.
Get up. It's for you. It's for us. It's for the nation.
Dallas is getting 5,000 doses this week. The city has been partnering with Dallas County to distribute the county's doses at Fair Park, but these 5,000 doses will be administered at the K. Bailey Hutchinson Convention Center downtown. It's going to be a drive-through distribution by appointment only, and it's for people who are already registered on the county's wait list.
New emerging science shows there is reason for vaccinated people to be optimistic about getting back to normal, but not so much for the unvaccinated. Let's start with the Cleveland Clinic in Ohio. Its study finds 99.75% of the patients this year who had to be hospitalized, sick with COVID, were not fully vaccinated. And of the employees who tested positive for the virus, 99.7% had not gotten the vaccine. Unvaccinated people in states like Colorado, Maine, Rhode Island, and Washington are having high infection spikes similar to the winter surge. And the African American community in Washington, D.C. is where 80% of the new cases are showing up because of the lower vaccination rates. And in some states, there is still a steady death rate, but only among the unvaccinated. In Maryland, the risk of going to the hospital is going up if you're not vaccinated, possibly due to the variants that are spreading. So we wanted to know where Louisiana stands, but the state doesn't post infections or hospitalizations by vaccine status. But according to LCMC, which runs 6 local hospitals, the people coming into hospital emergency rooms with COVID are typically the unvaccinated. Very few who got the shot come in, and if they do, their cases are mild. So doctors say the bottom line is things are getting safer for the vaccinated. That's the reason the numbers are going down. But the unvaccinated are still at risk and getting the wrong safety message.
Immunocompromised individuals are vulnerable.
Dr. Anthony Fauci saying it's now clear many immunocompromised people are not adequately responding to the vaccines.
In this regard, it is extremely important for us to move to get those individuals their boosters. And we are now working on that and will make that be implemented as quickly as possible, because for us and for the individuals involved, it is a very high priority.
But as the Delta variant surges, there is intense focus on getting more Americans their first shot, with so much of the suffering now almost entirely preventable.
Universally, as we look at our hospitalizations and as we look at our deaths, they are overwhelmingly unvaccinated people.
Those in some of the hardest hit states are responding.
Tennessee has seen a 90% increase in first shots over the past 2 weeks. Oklahoma, an 82% increase. And Georgia, a 66% increase in first shots over the past 2 weeks. Clearly, Americans are seeing the impact of being unvaccinated and unprotected.
Breakthrough infections in fully vaccinated people are the exception, not the rule. And when they do happen, the vast majority are mild and asymptomatic. We have the most effective tool we need to keep us safe and end this pandemic, and that is a vaccine.
This is a day after the WHO said we need to be focusing on people getting their first vaccines rather than thinking about booster shots. So any indication now of how long it might take to start for this third round of shots for some people to start?
Important point, Devin. You know, they didn't give a timeline. Basically, they said just as quickly as possible. Now, that decision would actually come from the FDA, but it is clearly now a priority to make that decision happen.
The war has changed in the battle against COVID. New data made public today likens the Delta variant spread to the chicken pox. As the virus leaps person to person, it's more contagious than the common cold. Likely triggering more severe disease than previously known, the Delta strain is also infecting the vaccinated at higher rates, as they carry similar viral loads in their nose and throat as the unvaccinated. And while they too may easily spread the virus, the inoculated are rarely hospitalized.
The efficacy of a vaccine that isn't given is exactly 0%.
Despite the spike in cases, it's important to remember we are nowhere near last winter's surge in cases or the daily death count. Still, with the new data providing some concrete numbers on breakthrough infections, the concerning findings are why the CDC called for the vaccinated to also wear masks indoors in high-risk communities earlier this week. But scientists recommended the CDC go further, saying universal masking is essential.
The Delta variant has been a game changer. I think no one expected that it would have a contagiousness index as high as this. No one would have expected that this virus could be as contagious, say, as chickenpox virus, or more contagious than smallpox virus.
Tonight, health officials are on high alert after an alarming rise in COVID cases, with infections increasing in more than half the country and deaths up 11%.
The increasing trends in cases, hospitalizations, and deaths are very concerning, and they threaten the progress we've already made.
One big reason, variants, particularly the one that originated in the United Kingdom. At this Columbia University lab, Dr. David Ho first identified yet another variant circulating in New York City.
It's concerning because it's spreading at a rate that is on par with the UK variant, and we know the UK variant is more transmissible and more more lethal.
And now the CDC says they're investigating 2 more cases of blood clots in people who received the Johnson & Johnson vaccine, including one from the clinical trial, another woman and a man.
We recognize the critical importance of moving quickly.
In a statement released today, J&J says so far, evidence is insufficient that its drug was the cause of the clots. Still, there is concern it's scaring away the unvaccinated. After months of demand for shots outstripping supply, the situation in some areas is now reversed. Thousands of appointments at vaccination sites in New York and Chicago are unfilled as the country continues to brace for what's next.
Here in New York, roughly 5.4 million people have already been vaccinated by the state. Meanwhile, the White House said today it's likely that additional booster shots will be required in the future, and they're planning for it.
This morning, despite finding a likely association between the Pfizer and Moderna vaccines and a rare, mostly mild heart inflammation in younger people, a CDC panel says the benefits of a COVID-19 vaccine far outweigh the risk.
And when they did happen, they were really quite mild, and a majority of the patients recovered quite nicely.
In a joint statement, the CDC, HHS, and more than a dozen health associations calling instances of myocarditis after vaccinations extremely rare. CDC data reporting 323 confirmed cases in those 29 and younger. That's out of 26 million shots. Finding it happens mostly in young men about a week after the second shot. The CDC advisory group warning myocarditis is more likely if you get COVID, and that it will be more severe than if you get it from the vaccine. This comes as the more contagious strain of the virus is spreading across the U.S. The Delta variant now in at least 48 states. The spread of this variant a concern in areas with low vaccination rates, renewing the push from health experts to get more Americans to roll up their sleeves.
Researchers from a hospital near Paris looked back at people hospitalized in December of 2019 and early January 2020, looking for patients with symptoms and CAT scan findings that were consistent with COVID-19. Remember, back then, no one had any test for COVID-19 and no one thought it had gone beyond China. They identified a 42-year-old man with findings consistent with COVID-19 who was admitted on December 27th with 4 days of symptoms. The frozen samples taken at that time were retested and they were positive for SARS-CoV-2. Now, this man had no history of travel, and that suggests SARS-CoV-2 was in the Paris area at least 4 days before the first announcement of the virus in Wuhan, China on December 31st. Now, on the topic of how long SARS-CoV-2 might have been around, a new study from the UK that looked at natural mutations in the virus found the virus may have been circulating as early as October of 2019, although that time frame is based on modeling estimates and only provides a hint of when the virus entered circulation, not proof. The paper also identified nearly 200 recurrent mutations that the researchers believe are helping the virus evolve and adapt to infecting humans.
People are willing to pay extra for me to travel to it.
Do you not worry when you go to people's homes?
No, because I literally sanitise myself from head to toe.
It's just an hour. It's £40. It's reduced because of COVID-19. Usually I'm £120 an hour.
Yeah, pregnant now this 6 months. I needed the money, I need to pay my house.
Most sex workers are mothers working to support families. So if they don't have an income and they're facing not being able to feed their kids or losing their housing, then yes, some women are going to have to make that terribly hard choice of going back to work.
In months, states in more than half the nation are now reporting a climb in new COVID cases, while Michigan is home to the highest spike, 106% over the last 2 weeks. In Minnesota, authorities confirm 89 breakthrough infections in people after they were fully vaccinated. Meanwhile, a troubling new report shows in 13 states, coronavirus hospitalizations are on the rise.
Every day, I see the numbers for our hospital, for the other hospitals in our system, and it's all going up. I've seen people who looked good one day and the next day they're, intubated.
With 1,000 Americans still dying every day from the virus, the race between variants and vaccinations is at a critical crossroad. After safety regulators questioned their early data, AstraZeneca revised its vaccine efficacy down from 79% to 76%, perhaps undermining public confidence.
But Dr. Kim Rhodes says testing at a pop-up site like the church can yield valuable information for those studying the disease.
We're testing first-time testers, so we're capturing people that are not in their data sets.
And that's because they trust coming to a place like this.
And that's what we believe.
She says as they test more members of the African American community, a mysterious trend is emerging. The Black community has a much lower rate of infection.
We've tested close to 900 people at this point, and we've had 5 positives. 5.
The problem is, for Black people who do contract the disease, the death rate is much higher than usual. Dr. Rhodes says that may be physiological or the result of inferior health care options. She's not sure. It hasn't been studied. Right now, the questions all revolve around who is getting the disease, but that may be missing the point. Why do African American people have a lower infection rate? Are they doing something right that we're not doing?
I'm so glad you said that, because as we've been through, a number of tests, a number of different test locations around the city and seeing the same thing over and over again, I'm starting to wonder, should we be asking the question, what is it that is going right in the African American community with regard to this pandemic?
It may turn out that success in fighting the disease will depend on studying those who are not getting it as much as those who are.
Rasta, it's not the UK strain that's dominated the headlines in recent weeks. It's actually another strain that's now circulating here. Something that's not unexpected, but also not without concern.
Yeah, it's been detected in San Francisco and Santa Clara counties, as well as up and down California. And tonight we are learning this particular strain is linked to that massive outbreak at San Jose Kaiser Hospital.
The Kaiser San Jose outbreak involved dozens of employees, including one who died. More than a dozen patients also contracted COVID, and tonight public health officials say this new coronavirus variant is part of that outbreak. They're still trying to figure out why it spread so quickly. Right now, public health officials do not have enough data to conclude that this variant, called L452R, is more transmissible or more deadly. But in the places where it has been spotted, including Santa Clara County and San Francisco here in the Bay Area, it has spread pretty quickly. How effective will the vaccine be against this new variant?
These are exactly the same kinds of concerns that have been raised with the UK variant, for instance, and the South African variant. And this is why these are critical studies that need to be done.
So far,
this new variant is just another reminder that there is a lot that we don't know.
Colorado Governor Jared Polis at a press conference with state health officials confronting the possibility that the so-called variant virus, in all likelihood, is already present in the community.
Neither of these cases has traveled internationally in the weeks prior to their illness.
Colorado State epidemiologist Dr. Rachel Herlihy says the 2 National Guardsmen in question are under monitored quarantine as the state's health department investigates the Colorado Springs assisted living facility where the 2 were working.
Based on the testing that has been performed in that facility, we do not have evidence that the variant virus is circulating.
Good news, but the variant, believed to be between 50 to 70% more transmissible than the COVID-19 virus, raising concerns. The concern is that a surge of patients will overwhelm hospitals and medical personnel.
Here, moments ago, the FDA advisory panel voting not to recommend booster shots of the Pfizer COVID vaccine for people 16 and older. The rollout, we were told by the White House just yesterday, was going to get started on Monday.
So kids are at higher risk of heart inflammation, myocarditis and pericarditis. Their immune response and inflammatory response is just a lot stronger. Right. So Dr. Seymour today and the FDA panel, Dr. Stern, both really warned about the unknown with kids. We've seen these complications clustered around the second dose of the mRNA vaccine. And so when we're talking about a third, don't you think we should have good data? That was their argument. I'm concerned as well. And finally, the global equity issue came up. Remember, half the world has not gotten any vaccine out of Israel. Showing natural immunity is 27 times more effective than vaccinated immunity.
Good news for kids. Pfizer says in early trial results, its vaccine shows a 100% efficacy rate in children 12 to 15. The drug maker also conducting clinical trials in children 6 months to 11 years old.
Have discussed hiking the vaccine price after the pandemic wanes. They basically were caught saying that the pandemic is not going to end. It's going to turn endemic. And when it turns endemic, they're going to make a boatload of money off that vaccine that they made. It says a top executive for Pfizer suggested to investors last week that pricing for its COVID-19 vaccine could increase post-pandemic. So not only are they excited that COVID is going to continue on and on and on forever, but they're saying they're going to actually hike up the price of the vaccine. The suggestion raises questions about whether a drug developed at the behest of the federal government to respond to a global crisis could turn a profit for one company.
The U.S. began vaccinating the population against the coronavirus in December of 2020. The goal is to get the COVID vaccine to every person in the U.S. who wants one. But survey data shows that nearly 40% of the U.S. population doesn't want it. Widespread mistrust might have something to do with the fact that if anything goes wrong with the vaccine, the drug makers that produce them aren't responsible.
This is a remarkable circumstance. It's certainly not like anything anybody's ever seen before.
That means that companies like Pfizer and Moderna have total immunity against lawsuits related to injuries resulting from taking the COVID vaccines. Meanwhile, employers are legally allowed to require employees to get immunized against the virus. Frontrunners Pfizer and Moderna built their COVID vaccines with a new kind of technology that's never before been licensed in the U.S. Typically, a vaccine puts a weakened or inactivated virus into our bodies to trigger an immune response. But the coronavirus vaccine relies on messenger RNA, which contains a piece of genetic code with instructions for our body. The mRNA tells our cells to make a protein, the same protein that's a spike on top of the actual coronavirus. This is what triggers the immune response to COVID-19, which then produces antibodies. Those antibodies are what ultimately protect us from getting infected if we ever encounter the real thing. Both companies have said that taking their vaccines could result in side effects similar to mild COVID symptoms like muscle pain, chills, and a headache. Even though side effects of the vaccine resemble COVID-19 symptoms, it's impossible to contract the coronavirus from the vaccine because the mRNA vaccines that Pfizer and Moderna are making don't use the live virus. One Pfizer trial participant told CNBC that after the booster shot, he woke up with chills, shaking so hard he cracked a tooth. For him, it hurt to even just lay in his bedsheet. But this kind of reaction isn't the norm. Roughly 4 in 10 Americans say they would definitely or probably not get a vaccine. While this is lower than it was 2 months ago, to achieve herd immunity, experts say that about 70% of the population needs to be vaccinated or have natural antibodies. If you suffer severe side effects after getting the COVID vaccine, there's basically no one to blame in a U.S. court of law. Take the vaccine makers. Health and Human Services Secretary Alex Azar invoked the Public Readiness and Emergency Preparedness Act in February of 2020, which protects the makers of COVID products such as vaccines and treatments from legal action. This protection lasts until 2024. That means for the next 4 years, companies like Pfizer and Moderna can't be sued for money damages in court over injuries related to the administration or use of products to treat or protect against COVID-19. But drug makers, like Pfizer, continue to reassure the public no shortcuts were taken.
This is a vaccine that is getting approved by all authorities in the world, so that should say something to them.
But remember, it was the FDA that actually cleared the vaccine for use. So does the federal government bear any responsibility?
You can't sue the FDA for approving or disapproving a drug. That's part of its sovereign immunity.
There are limited exceptions, but legal experts say they don't provide a viable legal path to hold the government responsible for a COVID vaccine injury. Anti-discrimination laws also provide some protections. But legal experts say that if an employee is forced to get a vaccine and suffers a debilitating injury from it, claims would be routed through workers' compensation programs and treated as an on-the-job injury.
So if you're looking for accountability, you're probably going to have to use other accountability tools beside the court. If you're looking for compensation, you should use a government compensation program.
The National Vaccine Injury Compensation Program, better known by the name Vaccine Court, is relatively easy to use and generous in terms of what it's willing to pay out to those who are eligible. But because the COVID vaccine has not yet been recommended for routine administration to pregnant women or children, it doesn't qualify. Another program, and the only real pool of cash available to those harmed by the COVID vaccine, is a fund attached to the PrEP Act. The so-called Countermeasures Injury Compensation Program has been around for a decade, but experts specializing in vaccine law say it's a lot more difficult to navigate.
The problem with the PrEP Act is that it's attached to a government compensation program that's very hard to use, where the bar for compensation is very high.
Since the program began 10 years ago, the CICP has only compensated 29 claims, totaling more than $6 million. If a case for compensation through the CICP is successful, however, the program provides up to $50,000 per year for unreimbursed lost wages and any out-of-pocket medical expenses. It won't cover legal fees, nor anything to compensate for pain and/or suffering. It's also capped at the death benefit of $370,376, which is the most that a surviving family member receives in the event that a COVID vaccine proves to be fatal. There's also a strict one-year statute, meaning that all claims have to be filed within 12 months of getting the vaccine.
It's louder than his car's stereo, and it's the sound Robert Edmonds can't get out of his head.
Yes.
Kind of sound?
Yes. It's a constant high-pitched ring.
This federal government employee came to Phoenix seeking a specialist, hoping for belief and relief for tinnitus that he says developed after receiving his COVID-19 vaccine. George got his shot in February.
The very next morning, I noticed I started having what felt like congestion in my ear, and then it got worse by the second day, and the third day, I literally couldn't hear anything out of it.
A doctor prescribed steroids, and George's hearing returned, along with a ringing sound that persists to this day. But he's not willing to discount a connection between the vaccine and tinnitus. Why? He got it too.
I can't tell with absolute confidence that it was a result of the vaccine. I can only say that it happened an hour, hour and a half after getting the vaccine.
The ABC 15 investigators heard from people all over the country who said they reported sudden or worsening tinnitus to the CDC's Vaccine Adverse Event Reporting System, VAERS. In all, more than 10,000 Americans, including 217 Arizonans, reported. That's 1 out of every 21,000 people who got the COVID-19 vaccine. The European Union's equivalent to the FDA, called the European Medicines Agency, looked at data from both clinical trials and the initial vaccine rollout. And they're now recommending the Johnson & Johnson COVID-19 vaccine add tinnitus to its list of possible side effects. Here in the U.S., the FDA and CDC have also been looking at the data, and they've actually associated the vaccine with several rare but serious potential adverse health effects, except tinnitus. They say there's no causal relationship between this condition and the vaccine.
There seems to be a difference of opinion between Nicki Minaj and the White House about what she was invited to do. Did the White House extend an invitation to Nicki Minaj to come here?
We offered a call with Nicki Minaj and one of our doctors to answer questions she had about the safety and effectiveness of the vaccine. This is pretty standard and something we do all the time. It was a very early stage call at a staff level, staff to staff, and we weren't even at the point of discussing, or we're not even at the point of discussing, I should say at this point, the mechanisms or the format or anything along those lines. It was simply an offer to have a conversation and an early stage call.
And do you think that's going to happen?
We'll see. I don't have anything to predict for you.
Nicki Minaj has 22 million Twitter followers. Why not invite her to the White House, have a conversation, and make it a big public thing?
Well, I appreciate your recommendations on our communications advice. Karen, you are quite experienced. Look, I will say we recognize, and we've talked about this a bunch before, that we are not always the right platform or the right voice, right? Sometimes that's because people may not like the president, and they may not have voted for him. It's also true that when we're reaching a range of audiences, young people, where we've seen lower rates of vaccination is a good example. We know there might be more effective voices. We don't always know how effective working in partnership with celebrities may or may not be, but sometimes it is a tool that we can use or we've employed. Nicki replied saying, "I have an infant with no nannies during COVID. Who mad?
not risking his health to be seen. One yourself.
The singer explained that she was supposed to attend the MTV VMAs the night before, but had to drop out last minute, saying this: "Love you, babe. I was prepping for VMAs, then I shot a video, and guess who got COVID? Do you know what it is not to be able to kiss or hold your tiny baby for over a week? A baby who's only used to his mama." She added, in quotations, "get vaccinated." Drake had just told me he got COVID with the vaccine, though, so chilly.
Now, writing, they want you to get vaccinated for the Met. If I get vaccinated, it won't be for the Met. It'll be once I feel I've done enough research. I'm working on that now. In the meantime, my loves, be safe. Wear the mask with the 2 strings that grips your head and your face, not the loose one. That she recommends getting the vaccine and will likely get the vaccine as soon as she wants to go out on tour.
And people like Nicki Minaj, I have to say this. You have a platform, sister, that is 22 million followers. Okay, I have 2 million followers. You have 22 million followers on Twitter. For you to use your platform to encourage our community to not protect themselves and save their lives, my God, sister, you could do better than that. You got that platform. It's a blessing. It's a blessing that you got that people listen to you, and they listen to you more than they listen to me. For you to use your platform to put people in the position of dying from a disease they don't have to die from, oh my God, as a fan, as a hip hop fan, as somebody who was your fan, I'm so sad that you did that.
About this, but you have over 22 million followers, and in other tweets, she's basically told people, make sure you're not feeling bullied into getting the vaccine, and she's questioning Drake, almost essentially saying, what's the point of getting the vaccine? Yeah, if people are getting it when they're vaxxed.
People we're paraphrasing a lot. Nicki Minaj said that she was going to get the vaccine. She will get the vaccine when she wants to go on tour. That Joy never said that last.
When she wants to go on tour.
Yeah, but I think that's the problem, is that you take one thing and you're attacked for it. Like Joy, she didn't go through all the things Nicki Minaj said and broke it all down and tried to sort of make sense of it. Mm-hmm. She didn't mention the parts where Nicki said that she would be vaccinated. She didn't leave in the parts where she told people to mask up. It was only that one specific thing about being hesitant to getting vaccinated, and then it went into straight attack mode and not anything else. She had the opportunity to sort of try and make sense of all the things Nicki said, but you choose not to, and you go after the one thing, and you make somebody out to be something that they're not.
Last week shows those previously infected with SARS-CoV-2 have natural immunity that offers 13 times more protection against the Delta variant than vaccination alone. In May, the World Health Organization found that the immune systems of more than 95% of people who recovered from COVID-19 had durable memories of the virus that remained fairly stable over time, only declining modestly at 6 to 8 months after infection. Also, 6 studies, which encompass nearly 1 million people from Qatar to Denmark to the U.S. Marines, all found that the range of reduction of reinfection from COVID-19 was between 82% to 95%, and found that naturally induced immunity resulted in extremely low rates of hospitalization and death in the event of repeat infection.
Well, the lab leak theory is continuing to gain momentum, and there are now concerns Dr. Anthony Fauci lied when he was under oath while speaking at Senate in July. Dr. Fauci is the director of National Institute of Allergy and Infectious Diseases and oversees several programs at the NIH. According to The Intercept, just shy of $600,000 of the $3.1 million went straight to the Wuhan Institute of Virology to study bat coronaviruses that could jump to humans. While Dr. Fauci acknowledged the NIH did provide funding to the EcoHealth Alliance, the money was not gain-of-function research. Gain-of-function is the medical research that alters an organism or disease in a way that increases pathogenesis, transmissibility, or host range. However, biologist Alina Chan wrote an assessment on the new documents and said, in this proposal, they actually point out that they know how risky this work is. They keep talking about people potentially getting bitten, and they kept records of everyone who got bitten. Does EcoHealth have those records? And if not, how can they possibly rule out a research-related accident? Dr. Anthony Fauci faced Senate in July, where Republican Senator Rand Paul accused the disease expert of lying under oath and that the research funded was technically gain-of-function.
This research matches, these are Dr. Ebright's words, this research matches, indeed epitomizes, the definition of gain-of-function research, done entirely in Wuhan. for which there was supposed to be a federal pause. Dr. Fauci, knowing that it is a crime to lie to Congress, do you wish to retract your statement of May 11th where you claimed that the NIH never funded gain-of-function research in Wuhan?
Your microphone.
Senator Paul, I have never lied before the Congress, and I do not retract that statement. This paper that you are referring to was judged by qualified staff up and down the chain as not being gain of function.
To me, it confirms what we've known for months, which is that Fauci lied to us. He lied to Congress. He knew that our taxpayer dollars were being administered by his organization to third parties like EcoHealth Alliance to do cooperative research, gain-of-function research at the Wuhan Institute of Virology. And when questioned about it, he hid behind a highly legalistic definition. But more to the point, he was lying. And the fact that he still has a job is an affront to the hundreds of thousands of Americans who have suffered, if not died, under coronavirus.
And so I think that particularly if you're vaccinated, but you can get out there, you're outdoors for the most part, at least when my children were out there doing trick-or-treating, and enjoy it. I mean, this is a time that children love. It's a very important part of the year for children. I know my children enjoyed it. So, I mean, again, particularly if you're vaccinated. If you're not vaccinated, again, think about it, that you'll add an extra degree of protection to yourself and your children and your family and your community. But we can gather for Christmas, or it's just too soon to tell? You know, Margaret, it's just too soon to tell. We've just got to concentrating on continuing to get those numbers down and not try to jump ahead by weeks or months and say what we're going to do at a particular time. The situation, though, does not change what Dr. Walensky said, that it is not a good idea to travel, period. I mean, if you absolutely have to travel and it's essential, then obviously one would have to do that. But we don't want people to think because they got vaccinated, then other public health recommendations just don't apply. One of the biggest things that are really not well understood is people ask, why should I even have to wear a mask after I get my second shot? And the reason is very clear, that the primary endpoint of the vaccine trial was clinically apparent infection. So you could conceivably get infected, get no symptoms, and still have virus in your nasopharynx, which means that you would have to wear a mask to prevent you from infecting someone else, as well as the other side of the coin, where you may not be totally protected yourself. So getting vaccinated does not say now I have a free pass to travel, nor does it say that I have a free pass to put aside all of the public health measures that we talk about all the time.
Yeah. So you're saying that the vaccine does not prevent necessarily against infection. Are you saying that that's the case, or we haven't shown it yet? Do we still have to just prove this out, Dr. Fauci?
Right. We don't, Sanjay, very good question. We do not know that as a fact, but we can now, as we get a few months into the follow-up, what we will be able to do is quantitative assessment of the amount of virus in the nasopharynx of a vaccinated person who got an asymptomatic infection compared to an unvaccinated person who had an asymptomatic infection. And then you can make an extrapolation from that, that if you have such a very low level of virus, it's unlikely that even though you were infected, that you would pass it on. But we don't know that yet. That associated with cohort studies where you actually look specifically at the spread, you'd be able to show it. Bottom line, Sanjay, this is an assumption that I think is reasonable, but we don't know the facts yet. That's the reason why we have to do this study.
Asking, are contingency plans now being made for alteration and redistribution of the mRNA vaccines in case one of the current or future variants of COVID-19 prove to render the current vaccines much less effective? So you can retool the vaccine, is that right?
Yeah, actually, this is the question that I believe I answered a little bit ago, but I'm glad that this questioner asked it again. One of the beauties, Sanjay, of the mRNA approach is that it's highly adaptable. So what you have is this bit of RNA, and you stick in the part of the RNA that codes for the protein of the spike that is in the virus that is now circulating in our country. When you want to adapt it to say, let's say we now want to protect against the South African isolate, you take that same mRNA and instead of sticking in the coding component for the virus that's circulating in our own country, you just quickly stick in the one that codes for the South African isolate. It is highly adaptable. And what you would do, and we're already starting that, Sanjay, this is something we're doing in collaboration with the pharmaceutical companies. We've already started that. And what you then do is you do a quick phase 1 trial to show safety and show immunogenicity. You don't have to do a 30,000 person trial or a 44,000 person trial. You work with the FDA and you could bridge information from one trial to another.
No, I wouldn't say it's impossible. I mean, we got rid of smallpox, right? I think we're talking years, though. This is years in the making to get this, totally, completely, really under control.
Epidemiologist George Rutherford says about 75% of the population needs to be protected from COVID-19 to reach herd immunity. But there are still 4 major hurdles. The first, vaccine hesitancy, which appears to be dropping.
The fact that it's going down and people are more reassured and willing to get vaccinated is fabulous news.
A new survey from the Kaiser Family Foundation found a growing interest in getting the vaccine, especially among Black Americans. 55% say they'd been vaccinated or plan to be soon, up 14% from just last month. Number 2, an uneven vaccine rollout globally.
The question is what are we going to do about Europe, especially Eastern Europe, what's going to happen in Africa, what's going to happen in India.
3, new variant strains like West Coast, UK, and the Brazilian variant.
So what does that very, very grim milestone mean for our country?
Well, it means that we didn't act as early as we should have. We didn't act as aggressive as we should have, as aggressively, and the numbers are continuing to go up, Wolf. I mean, it is grim. I mean, it's still hard for me to believe that the best that we could do in this country is be the worst in the world when it comes to these cases. Right now, the numbers are going straight up. We're sort of looking at this exponential growth. If we could even stall it so the numbers stop going up, that would be a very, very significant accomplishment, and it's within our power still. So, it's grim, but there should be hope.
There are stories circulating on the internet that in India and elsewhere, the drug ribavirin has been shown to be effective against this virus. Yet, Homeland Security is telling the CDC not to make any announcements until stockpiles of the drug can be secured.
Well, Dr. Gupta, there continue to be evaluations of several drugs. Ribavirin is among them. But right now, our best defense has been social distancing. No handshaking, staying home when you're sick, washing your hands frequently.
Can you tell us to date how many people have died from this virus?
Very difficult. We're still working on confirming that number. There are 50 different states in this country, which means there are 50 different health departments, followed by 50 different protocols.
Let me bring in Alan Crumwoody into this debate as well. Alan's a freelance journalist. He was the first to track the Shinko Busman video. Alan, today on Twitter, you wrote that the truth about this virus is being kept from the world by the CDC, by the World Health Organization, to allow friends of the current administration to benefit from it, both financially and physically.
There are therapies we know are effective right now, like Forsythia, and they don't even appear on the CDC website.
On your blog, you also wrote that the World Health Organization is somehow in bed with pharmaceutical companies?
Because they are. That's who stands to gain from this. They're working hand in glove. And the hand is reaching into our pockets.
The CDC is exploring Forsythia and other homeopathic treatments, but right now, there's no science to back any of these claims.
Or no way Dr. Cheever or the people who put him into power can profit from it.
We're not ruling anything out. There are people who are sick, people who are dying, and
they're not keeping us safe from this any more than they kept us safe
about the
from Wall Street or Katrina, American citizen.
We're working very hard to find out where this virus came from, to treat it and to vaccinate against it if we can. We don't know all of that yet. We just don't know. What we do know is that in order to become sick, you have to first come in contact with a sick person or something that they touched. In order to get scared, all you have to do is come in contact with a rumor or the television or the internet. I think what Mr. Crumwoody is spreading is far more dangerous than the disease.
Oh, really?
Yes.
That's funny.
What's funny?
No, I think you're funny, because if you check on Facebook, you'll find a communique attributed to Dr. Cheever by Elizabeth Nygaard about the quarantine of Chicago, hours before it was announced to the public. That's why I think he's a bit disingenuous when he says equal care for all and not just his friends.
Some pretty wild allegations here, Dr. Cheever. I mean, can you tell us what communication appeared and when? What exactly is the nature of your relationship with Elizabeth Nygaard?
So we're missing a lot of people. They don't know that they have the virus because they don't have symptoms. They're not getting tested, and they continue to spread. And, you know, remind you, Wolf, quickly, 40% roughly of people are asymptomatic. 40%. Another 40% just have minimal symptoms. But here's the point, 50% of transmission is occurring before any of those symptoms develop. That's why the hospitalization number is so critical to look at. That's the true metric that doesn't lie to you, Wolf.
Be the first pill used to treat COVID-19. This could become a reality, and very soon. Drug maker Merck announced this morning that its antiviral drug cuts the risk of hospitalization and death for people who have COVID in half.
Merck has paused its trial and plans to ask for emergency use authorization. Now, it's important here to note that this is meant for patients who are already infected with COVID. This is not a replacement for a vaccine.
This emergency use authorization application means the FDA will now look at this. But as you know, you guys just mentioned, Brianna just mentioned, this trial was paused because an independent group of advisors basically looks at the trial results and says, something's going on here.
Good. Something good is going on.
Something's good going on here, so much so that we don't think it's really even ethical to continue doing the trial if it's potentially as good as it sounds.
This is one of the things that's been missing all along, right? I'm not saying this is not a replacement for vaccines. Vaccines are still the most important thing here. But early on, before the vaccine, everyone was hoping there'd be some miracle drug that could keep you out of the hospital if you caught COVID.
Yeah, you know, it's really interesting, John. Just historically, we think about antibiotics. There's lots of antibiotics for bacterial infections. As far as antivirals for viral infections, really in the world of HIV/AIDS, that's where most of it's been studied. There's things like Tamiflu, you know, but there's never really been sort of the big antiviral push. There's never really been a lot of funding for it. Every time something like this happens, a potential viral outbreak, there's renewed interest, and then it kind of fizzles, having covered this for 20 years. So here now you have a couple of products. This is the one from Merck, obviously. There's another one from Pfizer that's also being investigated. That sort of all along was being studied. And the thought was, look, it's probably not going to come in time for this pandemic because we'll have a vaccine maybe or something else, or the pandemic will sort of end by the time these antivirals actually get developed. But here we are, you know, at the end of 2021, still with the tremendous need for this. As you correctly mentioned, the vaccine still prevents people from getting the illness in the first place. This would be to treat people who are mildly ill, moderately ill, to keep them from getting into the hospital. Very important, potentially, especially in places where there's not enough vaccine or countries where people aren't willing to take the vaccine. When we talked about all the hype around hydroxychloroquine and things like that, the reason there was hype was, like, could you give something to people who were mildly, moderately ill, a pill that they could take at home and prevent them from going to the hospital? Everyone thought, look, it's a little bit of a pipe dream. Remdesivir sort of came close, but further trial results did not show it to be as promising. Hydroxychloroquine, ivermectin never had data behind it. Hydroxychloroquine may be even potentially problematic, harmful to patients.
A COVID treatment in pill form, the first of its kind. Merck with new data out today showing its antiviral drug, taken twice a day for 5 days when symptoms begin, cuts the risk of hospitalization and death in half.
This is a phenomenal result. I mean, this is a profound game changer to have an oral pill that had this kind of effect.
Merck says it's seeking emergency use authorization as soon as possible. The federal government has already contracted to buy 1.7 million doses.
We always hesitate to make any timelines.
The experimental pill is being compared to Tamiflu, which is supposed to be taken within 2 days of flu symptoms. Still, the new drug has only been tested on unvaccinated people, so more studies are needed.
If approved, I think the right way to think about this is a potential additional tool in our toolbox to protect people from the worst outcomes of COVID.
Vaccines, experts say, are still the best tool. And with that in mind, today California Governor Gavin Newsom announced that the COVID vaccines, once fully FDA approved for kids, will be required in all of the state's public and private schools, affecting nearly 7 million students, grades K through 12, the first such mandate in the nation. A U.S. Supreme Court justice has now denied New York City teachers' request to block their vaccine mandate. Meanwhile, the New York governor says 87% of the state's healthcare workers are now fully inoculated. Krista Michael from Rochester hasn't been and might soon be out of a job. Today, the CDC director would not say whether she thought we're seeing the last major wave of the pandemic. Still, nationwide, new cases and hospitalizations are both down about 15% since last week.
And I think that vaccines have to be considered the bargain basement technology for the 20th century.
Among the discoveries he made at Merck are vaccines for mumps, rubella, and measles.
Tell me how you found SV40 in the polio vaccine.
Well, that was a Merck thing.
Okay.
Yeah, I came to Merck, and I was going to develop vaccines. Mm-hmm. And we had wild viruses in those days. Remember the wild monkey kidney viruses and so forth? And I finally, after 6 months, gave up. I said that you cannot develop vaccines with these damn monkeys. We're finished. And if I can't do something about it, I'm going to quit. Mm-hmm. I'm going to try it. Mm-hmm. So I went down to see Bill Mann at the zoo in Washington, D.C. And I told Bill Mann, I said, look, I got a problem. I don't know what the hell to do. Bill Mann is a real bright guy. I said, these lousy monkeys are picking it up while being stored in the airports in transit at these loading, offloading, mm-hmm. loading. He said, very simple. He said, you go ahead, get your monkeys out of West Africa, get the African green, bring them into Madrid, unload them there. There are no other traffic through there for animals. Fly them into Philadelphia, pick them up. Or fly them into New York and pick them up right off the airplane. So I brought African greens in. I didn't know we were importing AIDS virus at the time.
And it was you who introduced AIDS virus to the country.
That's what he did. He brought in, we brought in those monkeys. Now we had those. Mm-hmm. And this was the solution. Because those monkeys didn't have the wild viruses. But we had all of these.
Why didn't the greens have the wild viruses since they came from Africa?
Because they weren't being infected in these group holding things with all the other 40 different viruses.
But they had the ones they brought from the jungle, though.
Yeah, they had those, but there were relatively few. What you do is you have a gang housing, you're going to have an epidemic transmission of infection in a confined space.
Oh, is that the problem?
So, anyway, the greens came in. Now we had these, and then we're taking our seed stocks to clean them up, and God, now I'm discovering new viruses. So I said, shoot us, priest. Well, I got an invitation from the Sister Kinney Foundation, which was the opposing foundation, and that was the live virus.
Oh, right.
Yeah, they had jumped on Saban's bandwagon. Mm-hmm. And they had asked me to come down and give a talk at the Sister Kinney Foundation meeting. And I said, it was an international meeting. I said, God, what am I going to talk about? I know what I'm going to do. I'm going to talk about the detection of non-detectable viruses as a topic. The detection of non-detectable viruses. And I told Albert...
But at this point, Saban is still just doing these massive field trials.
Mm-hmm.
Okay.
In Russia and so forth. So I go down, I talked about the detection of non-detectable viruses. And I told Albert, I said, listen, Albert, I said, you and I are good friends. But I said, I'm going to go down there and you're going to get upset. I'm going to talk about a virus that's in your vaccine. Now, you're going to get rid of the virus. Don't worry about it. You're going to get rid of it. But, so of course, Albert was very upset with me. And
what did he say?
Well, he said basically that this is just another obfuscation that is going to upset vaccines. And I said, well, you're absolutely right. But I said, we have a new era here. We have a new era of a detection. And the important thing is to get rid of these viruses.
Why would he call it an obfuscation if it was a virus that was contaminating the vaccine?
Because, there are 40 different viruses in these vaccines anyway that we were inactivating. And...
but you weren't inactivating his, though.
That's correct. No, that's right. But yellow fever vaccine had leukemia virus in it. And, this is in the days of very crude science. Mm-hmm. So anyway, I went down and talked to him, and Albert said, well, why are you concerned about it? I said, well, I'll tell you what. I said, I have a feeling in my bones that this virus is different. I don't know why to tell you this, but I've been around biology a long time. I just think this virus may have some long-term effects. And he said, what? I said, cancer.
I love it. I love it. Go ahead.
No. I said, Albert, you probably think I'm nuts, but I just have that feeling. Well, in the meantime, we had taken this virus and put it into hamsters. So we had this meeting, and that was sort of the topic of the day, and the jokes that were going around was, gee, we would win the Olympics because the Russians would all be loaded down with tumors. This is where the vaccine was being tested. This was
right. Right.
So, and it really destroyed the meeting. You know, it was a big international.
Yeah, right.
So it was sort of the topic. Anyway.
Was this the Cancer Society meeting in New York?
No, this was the Sister Kinnick.
Oh, the Sister Kinnick, right.
And Del Becco got up and said that he foresaw problems with these kinds of agents.
Why didn't this get out in the press?
Well, I guess it did. I don't remember. We had no press release on it, obviously. You don't go out. This is a scientific affair within the scientific community. But anyway, we knew it was in our seed stock for making the vaccine. That virus, you see, it's 1 in 10,000 particles is not inactivated by formaldehyde. It was good science at the time because that was what you did. You didn't worry about these wild viruses.
So you discovered it wasn't being inactivated in the Salk vaccine?
Correct. So then, the next thing you know is 3-4 weeks after that, I found that there were tumors popping out in these hamsters.
Despite AIDS and leukemia suddenly becoming pandemic from wild viruses, Hillerman said this was good science at that time.